let's talk about suicidality in a person that got arrested or a person that is in jail. Whenever you work in the jail environment, there are multiple factors that can put somebody at risk for suicidal, to be, to have suicidal ideation. So what is going on with P. Diddy? P. Diddy got arrested. People are saying that he's presenting with suicidal ideations. He's on suicide watch. Okay. Yeah. People are thinking because of the withdrawal symptoms. No. This is what I have to say. He has been arrested. He requested a bail. And because it's his right, he's supposed to get a bail. But it depends. If you're at risk, if for yourself, you are a danger to society, they will not give you. There are multiple factors. And considering the magnitude of the charges, he may not be given a bail. And that came as a shock. So the shock, like, it's my right. I'm supposed to get it. Like, why not? Then he filed again for the second appeal for the bill. That also was turned down. So now he's facing what? Shock. Like, ooh, this is becoming my reality. This is my real life. You understand? So that is what is causing oops. So finally, he went to the shock. Then denial. No, not me. So now he's going to be back. The shock is there, but he's going to be going back and forth between denial and bargaining. Like, God, if they can give me bail, let me go home and do this, do that, let me fix my nyash, let me do this, do that. So that is enough to make him feel suicidal. Secondary factor that is complicating the suicidality is the fact that he is heavily a chronic user of substances, all kinds, including alcohol. So all that also is going to withdraw from alcohol. He's going to go through the DTs. If you work in the ED, most of the time when a patient come in, withdrawal symptoms are one of the things we watch for. Or you work in acute care environments like hospital, those are some of the things they look for first and foremost. In the first 72 hours of admission, they have to watch you for withdrawal symptoms. Maybe you are shooting something on the street. Being in a hospital environment, you are not going to have it in your system. It is expected that you're going to be suicidal. You're going to be having withdrawal symptoms, which could be another symptom that will come with that could be SI. You could have SI symptoms. You see that? So the issues with him right now is not the withdrawal. The primary causative factor of his SI symptom, the suicidality, is not the withdrawal. In my opinion, from a clinical standpoint, that is just complicating it. That is a contributing factor. But the primary reason why he is SI is the shock. That, like, why me? Because he's so possessed with power and he's done all these things and nobody could get him till now. Like, I'm powerful, I have money, like, what can't I, like, why me, So that is what is going on. So though somebody asked a question, do you think the SI is because he's going through the withdrawal symptoms? Possibly, but that is not primary factor. That is being complicated. The withdrawal symptoms are being because the fact is, with everything going on, he could also have like nightmares. He could have nightmares related to drug use, because sometimes people who have substance use, they have nightmares not because they have PTSD, but because they can be hearing voices to go and seek the drug, to go and seek. It is like I say, it's an addiction situation. So he's not only just addicted to the drug and to the substances, he's also addicted to power. He possesses so much power and he thinks he's powerful that nobody can do anything to him except himself, I guess. And finally, so it's like a lot of things are coming as a shock to him. He feels overthrown. That is eating him up, and that is what is causing the I'm losing it. And they know if you have a patient in inpatient psych unit on in the like in corrections, let's say they went to court today, and they went to court and they were expecting that they would lessen their charge or they would be sent home, and then they came back. They got disappointed and they came back. Guess what will happen? They are automatically put on suicidal watch. You get it? They are put on suicidal watch. So, excuse me, because of that, we have to be monitoring them for at least 72 hours to see if they are stable before they will take them off the watch. So a person like Diddy, he will be on that for a while. He will be in maximum security jail. He will be given smoke, the thick smoke. He will not have anything on. They will sometimes put chain on his legs, his arms, in his back. He will be like on a tight watch. You understand? So yeah, don't forget, I'm saying this because I have worked for 9 years as a acute mental health child nurse on a correctional unit, on the acute unit when they first come in. So that's what I'm saying. I'm describing possibilities of how he'll be dressed. They will not give him, they will not put him in an environment. He will not have any clothes on, no boxer, no nothing, no just the thick smoke. That is if, so that he don't have he has less risk of using any of the sheets or anything to tie himself or anything. This is very much what is to be expected. So yeah, to answer the question, Miss Divers on Facebook asked the question. So this is just to you share your opinions, to share your experience in the comment section. What do you think could be complicating or contributing to his SI symptoms at this point? This is from experience standpoint. The primary thing that is making him lose it, first of all, is the change in his lifestyle. All of a sudden, this is becoming his normal life. That, and then the withdrawal symptoms will come also with SI symptoms and hearing voice or hallucinations. And then I'm sure the reason I'm not worrying about the withdrawal symptoms is because it is expected, and they should be equipped to manage that. If it's in the hospital, of course they'll give you IVs, my banana bag, all kind of things, Valium, things to lorazepam, and there's another medication for withdrawals that they will give, so. But for the inpatient situation like this, I don't know. For a person that have this, a lot of things in his system, I don't know. But that is less of my issues. What more is my issue is the fact that there's a change in his circumstances, and that is number one reason why he is having the SI. The withdrawal is going to be a complication that comes with the withdrawal. Is the hallucinations he may be getting, and it could be any form of hallucination, from tactile hallucination to visual hallucination to so all that is expected. However, I'm sure they are equipped to handle it. I believe he will be fine. He will be just fine in there. And I'm not here trying to take side. I'm here just to educate on what could be causing the SI symptoms that he's reported to be exhibiting. All right. If you want to know more of the detail, I think I can research more and tell you the specifically. I'm sure it's on the news somewhere, the specific kind of withdrawal symptoms he's having or he's presenting with, aside the SI symptoms. Talk to you guys later. Don't forget to share this video. Follow me for more content related to mental health and medicine as a whole. If you have any issues with, don't forget I message Facebook for mental health specialists. So love you. Have a good morning. I'll talk to you later. Bye. My name is Mamli, for those who wonder. Oh, Epawawa, yeah. Epawawa is educating public parental alienation, but my name at birth is Mamli. Thank you guys. Bye.